For people that don't know, I've had a chronic low back problem to the point of I was offered surgery for a ruptured disc in my low back, and which created an instability, and physio helps, has kept me off the surgery table. But I got to the point as I'm getting older and with my hypermobility becoming more of a problem, I was looking for different solutions because I was struggling to get out of bed. You guys saw in clinic, I was, some days I was struggling to bend, move, and life was just being pretty rubbish. And I just thought, okay, is this it? I'm in my 40s now and I could go on till I'm 80 or 90 and I don't want that life. So I was talking to a fellow health professional and he recommended that we try EMS. He'd got it in his clinic. And he said, why don't you bring it down and get, I think it'd be really good for you. Or he actually said to find someone local in the area. But there was no health professionals. There's only one person in Southend, and they were not a health professional that was doing EMS. And with the complexity of my low back issues, all what I've gone through, and with my hypermobility, I didn't feel that that was the right person for me. So I wanted a health professional. Couldn't find anyone. I think there's maybe one in London, one in Manchester, obviously too far to travel. So contacted EMS, got them down and did a trial with the team, and I thought, well, got a bit selfish reasons, going to get it in the clinic for me if it works, if we love it. And also the team had to love it as well and could see the benefit for our clients. So that's what drew me to EMS. We all did the 12-minute session and my God, yeah, my legs were killing me the next day, as was my bottom. So it was great. So I felt like I've been to the gym, and I haven't been to the gym in years because A, I couldn't because of my back, and B, the gym is not for me. It's not my place. I don't enjoy it. But I literally felt like I'd done a couple of hours session in the gym after that 12-minute session. Where am I now? So I'm about 14 sessions in, and it's a lifeline for me. And no, I'm not just saying that because it's my clinic, I've bought it. It's me as the patient, and the guys have all done sessions with me, but Jack does most of my sessions, and he treats me as a patient. So he's actually treated me on the physio couch as well as doing my EMS sessions. But I'm now at a place where, as I say, it's been a lifeline. So now I used to get out of bed and I'd feel about 80 years of age, and it'd take me a good half an hour to an hour to get moving. I'd literally walk like I'd just got off of a horse. Whereas now I get out of bed, I don't have that morning stiffness, I don't have that pain, I don't have that fear of, oh God, I've got to bend to brush my teeth, or oh God, I've got to bend to lift up the toilet seat, because my back had got that bad that it was clicking, clunky, and they were painful clicks, they were really horrible. And I knew it was becoming more and more unstable. So now I get out of bed and I feel my age, I feel in my 40s. I can climb the stairs two at a time, which I haven't done for years. The other day, like I said to you guys, Emily went to Emily's athletics training session, and I ran across the infield of the track at Garren's. And I just did it, and then I thought, oh God, maybe I shouldn't, it's on an unstable surface, but I had no back pain. I then ran down the 50 metres with the children on Sunday. I haven't run for years because my back was hurting, and I had no pain. And the next day and all this week I've had, I wouldn't say touch wood, but I've had no flare-ups, no repercussions from doing that. And this is it's just wonderful because it's just given me my life back. And the other big thing that I said to Jack the other day, and you guys heard, was for the first time in years, I slept without pillows under my knees, because normally if I have my legs straight, my back arches too much, then I get back pain and it's stiff when I get out of bed. I haven't had the pillow and I've got out of bed absolutely fine. It's night and day. It's just been a game changer for me. It's been life changing, which is fantastic. I feel like I'm getting my life back. And I'm getting my shape back as well. So, before Emily, I was, very slim. I mean, I'm still slim now, but I was slim, I was fit, I was athletic. And, I'm getting my pre-baby shape back, which is nice as well. EMS is known for, a lot of the fitness models use it to keep in shape. and it's known for that, it's known for weight loss, but I didn't do it for that. I purely, selfish reasons, got EMS in the clinic for my back, because I literally thought, if this can help my back, it can help so many people's back problems. Like, I've had my back pain since I was a junior physio, so it's 1997, so decades. And as I say, I was offered surgery, didn't want it, refused it because physio and Pilates helped me. But I even got to the point where Pilates was aggravating me. So I felt like, okay, I'm in my late 40s now, I don't want to risk, getting health problems like, diabetes, heart attacks, whatever. I was getting unfit, whereas EMS has now allowed me to become fitter again. So as I say, I am getting fitter. I'm now moved on from the back invigorate program onto the body forming and the fitness programs. But I couldn't have done that at the start because my body and my back wouldn't have let me. But the thing that's changed, the only thing I've added in is EMS. And when I go, you guys know I go for my walk every morning when I drop my daughter off at school. And I go for a walk along the seafront, and even that now, I used to get, sometimes if I caught my heel wrong, I'd get like a lightning bolt pain in my low back. All gone. But it's just, I walked around the corner the other day to go to the post office, and I thought, I feel like a normal human, and I haven't felt like that for decades. So it's been brilliant. Some of the movements are the same on the Back Invigorate program. So Back Invigorate is specifically for people with chronic back pain. There's more lunges. I get out of breath more. I get a little bit hot and sweaty. So it's more of a fitness-based program. So it's to challenge me a bit more. So in the Back Invigorate, you don't do things like lunges because it's too much of an unstable position. But now I'm at the stage where my back pain is under control and I've got more stability and more strength. I can now do those kind of movements. And obviously as we've progressed through the sessions, now Jack has racked it up. So obviously as you get better and you get fitter, we can tailor. So on certain exercises, Jack will turn my back electrodes up a bit more, or he'll turn my legs up a bit more, or my arms up. And the main dial overall has gone, I started on 50 odd, I'm now on 80. So, but I couldn't have tolerated that at the start. It's just as I've got stronger and in a better shape. Yeah, absolutely. As I say, I think because we know that women, or people generally, as they hit 30s, 40s, we start to lose muscle bulk and muscle strength unless you train. And the big thing, obviously, there was this big, hoo-ha about we all do HIIT training, and now it's all about strength training. Now, for a lot of women, and say for me, I mentioned it earlier, I don't like the gym. Don't shoot me for saying that. There's a lot of people that love the gym. Jack loves the gym. It's not me. And also, from a time point of view, I'm a mum of a nearly 9-year-old. I'm also a business owner, and I don't have the time to go to a gym 3-4 times a week. And when I used to go, it would be 2 hours in the gym because I want to make sure I did a thorough workout. Whereas this is brilliant. It's 20 minutes and it's once a week. You can't have it more than once a week. Well, 5 days is the absolute minimum in between sessions. And the reason is because the high levels of creatine kinase that builds up in your body, it can actually damage your kidneys if you have it too frequently. But for me, it's perfect. 20 minutes once a week, mix that in with my walks. It's just brilliant for a busy mum like myself. But also I noticed as I got older, like I said, I mentioned before, my body shape had started to change. So I was losing my athletic figure. So, I always talk about having 2 bottoms. My bottom was starting to sag. I had bingo wings, my middle was starting to get a little bit thicker. And since doing EMS, and I am happy to share my before and after pictures, but my shape has changed. Really, it's like back to what I was in my 20s. It's amazing. I've got a fibroid at the moment, which is very big in size. So obviously my stomach's it's gone back down, but I've got that in there, so it can help women that are struggling with fibroids as well. It's just, I think for women, once we hit a certain age, and if we don't like those kind of gym environments or haven't got the time, because you put yourself at the bottom of the pile when you're a mummy and when you're a working mummy. So this is the perfect solution from that point of view as well. So for me, it's a double win. I've helped my back. My back's in the best it's been for decades. I'm getting a happier life because my back doesn't hurt so much, and then I'm not worrying about the future. But also I'm getting my athletic shape back, and it's, you know, it's lovely. And as you know, us women, we would like to look good and feel good. So from that point of view, me being in perimenopausal, I don't want to go down the route of getting weaker and getting saggier, and EMS has really helped from that point of view as well. Research studies on the older population, you know, they've got all the graphs of how much people, you know, with balance and falls problems as we age. Like my dad does it, so dad's, hopefully we'll get him on camera. You know, dad's got Parkinson's, he's also, you know, in his late 70s, and he's doing really well in EMS. My mum's now doing it. Bobby's doing it for shoulder pain and his back pain. So it can help a multitude of people. Then equally, you've got people like Usain Bolt that have used it, and Emma Raducanu. So you've got top athletes that are using it to help their sports performance. So we've had EMS in a baby form for years in physiotherapy, where we can put electrodes on a quad, on a leg, and make the leg muscles strengthen and tone up. So this is it's a whole body version of that. So it's been around for years. It's nothing, the technology itself is nothing new. It's just, it's gone, the new bit is it's gone to whole body training, and you can kill lots of birds with one stone in only 20 minutes. So yeah, I love it. I speak as a patient, and say for my hypermobility, I must touch on that. So, you know, I'm hypermobile EDS. Lots of doctors have never put all my bits and pieces together about my heart palpitations and my stomach, and, you know, in previous videos we've talked about this, and my back pain and the clonking. And I literally used to say to Jack, I feel like a puppet on a string, because all my joints click, clunk, and now various ones will hurt at various times. And the clicking in my back has reduced significantly. If I do get a click now, it's not painful. Before, I would dread doing a pelvic tilt because it would hurt. I'd be, oh, here it comes, it's going to hurt. And it would. That's all gone. So for people that are hypermobile and EDS, it can really help us, because it just helps by strengthening and creating stability in the muscles around the joints. My hypermobility EDS symptoms have improved as well. Oh, it's fantastic, the feedback from the team, and just listening to people say, oh, I can now get out of a chair without having to use my hands to get out of the chair. Or, you know, people are, again, my friends started doing it we'll get Natalie on camera, sorry Natalie. But, you know, her shape, oh my gosh, she looks like a different woman. Like from where she started to where she is now. Sometimes I think, oh my God, that's my friend. She looks amazing, and she's not been an exercise person, but she's really embraced it and got into it, and I'm so proud of her. As I say, you've got, you know, people in their 70s using it, like my mum and dad. The results that the team are telling me people are getting is fantastic. People, you know, some ladies couldn't hold their legs up to have their pedicures done. They can now do that. You know, and it's that life changing. It's giving people back their lives, and it's putting smiles back on people's faces. So I'm so glad I had that chance. I went and saw and spoke to that fellow medical professional, because they're not local. You know, they're 2.5 hours away. If I'd not met him and had that conversation with him, I wouldn't have known about EMS whole body training. So that from that one chance conversation, it's given me my life back, and it's given other people in the clinic their lives back. So we love it.